My name is Suzanne Rockett. I'm here with Volunteer Service Aboard from New Zealand. I'm originally from England, but living in New Zealand for the last 8 years, and I've come out to Papua New Guinea. I'm a clinical nurse specialist prescribing diabetes. I'm here to help build capacity and knowledge and raise the awareness of type 2 diabetes. It's a lifestyle chronic progressive disease that is affecting Papua New Guinea and lots of indigenous population groups. East New Britain here in Kokopo has reached devastatingly high numbers, so that's the highest in Papua New Guinea. We've also got the highest recorded amounts of amputations through the complications of diabetes. So it's a lifestyle disease that is preventable. So we can prevent diabetes by choosing to eat well, move well, sleep well. We can manage it by those three things plus medication and getting to know your health worker. We're very lucky in East New Britain. This is one of only 2 clinics that are free at the point of care delivery. It's been funded by companies and by campaigns across the region to help fund this clinic.
My name is Ashwin Lau. I'm originally from East New Britain. I'm the nurse unit manager of Friendship and Friendly Clinic. I usually do the administrative work and the management of the clinic.
I'm Angela Vaula. I'm from East New Britain. My role is a nurse working sister Lao. We do conduct doctor's consultation.
At first, when they asked to run diabetic clinic, it was something very hard because you have to go for further trainings and update yourself with what is happening with lifestyle diseases. But when Suzanne came along, she has really helped me. Like, we were really almost at zero level before she came. But after now she's here with us, she has really boosted us to the next level. She developed a diabetic guideline for us to use, and it has really helped us to, we can prescribe medication when the doctors are not around.
40 years ago, rice and cabin biscuits were not part of Papua New Guinea's diet. And we're trying to educate and empower people to go back to making those important decisions about eating what's good for you and local food and local diet. And if we can get people to understand their own role, what choices they need to make, coupled with medication, people can live long and well with diabetes. And that's a really crucial message in a country where you're not used to taking control and ownership of your own health. It takes maybe 2 or 3 visits to gain somebody's trust, and often it's about bringing the family together. And you're a community, and you've got this huge community spirit here in Papua New Guinea, and whenever we do a health screen, each different colleagues are all happy to stand around and find out what their colleagues' results are. In New Zealand and England, we'd be going, go away, it's none of your business. Here, people want to know, and they don't want to know to laugh and be nosy. They want to know because they care with all their heart and they want to help each other. And so often, if there's an auntie outside or a little grandchild outside, even if they're 10, I get them in to listen. And before you know it, we've won them over, and we're on the way to recovering them from their diabetes. I'm very aware that as a white person I come in and I sometimes feel that I'm just a visitor passing through and I'm a bit of a fraud, and that the messages need to be delivered by key people in the community. So I'm always trying to find a key community member who I can work with to bring this message forward. I've had an enormous response from my weekly radio shows with Blessed Peter Toro, Joe. Joe's been incredible.
Our important slogan as we finish here.
Okay, so it's get tested, get treated, and live longer.
The Archdiocese of Rabaul have had a long relationship with VSA, New Zealand. As far as East New Britain is concerned, with the kind of people and the kind of communities that we are, there was no barrier at all to get people to not only understand the sickness but to get tested and make positive decisions about their health. And I think a lot of people are doing that. It was very wise of Suzanne to come to us. She has been able to get me, another person, to take ownership of what she came in to do. And for myself, I know that if Suzanne goes, I am empowered. I have taken ownership of the messages and the information that she has given, and I'm able to continue this.
When she leaves us, I think we're going to really miss her, and even our patients and even our general public, because she brought the light.
I've been here for 6 months, and the absolute privilege to be here has been incredible. The people, this local community, just want to learn. They're like sponges. I just get crowds coming around. Everybody wants to learn. So the privilege has been all mine, and it's just been a fabulous journey for me.
Get tested, get lit, live long.